Hi, it's your dentist. It's time we clear up some myths concerning dental implants. I get the cutest questions from my patients about implants. Myth number 1. Implants are like giant screws inside your head. Let's really look at the true size of implants compared to natural teeth. The widest diameter implant made by my system, Nora-Vinh, for example, is 4.8 millimeters in diameter at its widest point and 14 millimeters in length. A front tooth, in comparison, at its widest point is, on average, 8.5 millimeters, which is almost twice as wide. One of the implants from another company, Horizons, has its widest implant diameter at 6 millimeters for use to replace back teeth or your molars. The diameter of the average molar is 10.5 millimeters, which is still much wider than the widest full-length implant. A 4.8 implant diameter is still less than half a centimeter. We're talking millimeters, not inches. You might be wondering how an implant, which seems much smaller than a natural tooth root, can be actually used to anchor a whole tooth. The magic is in the type of surface of the implant. A dental implant has a special surface that attracts bone to grow around it. The surface is most commonly acid etched to produce lots of microporosities. These microporosities attract bone to grow into it, thus locking the implant to the bone in a process called osseointegration. Osseo meaning bone, and integration meaning to unite or combine. My system uses a new zirconia titanium interface called Rock Solid that allows for even more rapid, stronger integration. The implant itself has threads on its body designed at a very specific pitch and thread and angle and size so that it facilitates bone cells to settle in and mature into calcified bone. There is not one aspect of implant body design that is random. Implant design has been around since the 1960s, when some doctors in Germany started using them in animals and were shocked to see that they behaved like real tooth roots. Now we can get a lifelike tooth using very small implant sizes and diameters, and the reason is in the design of the surface and the threads. Myth number 2. Implants hurt a lot. Pain is subjective, but before we give this myth the status of relative truth, remember why the implant should be placed in the first place. An implant replaces a missing tooth or missing teeth. In some rare cases, you might not have these teeth from birth. These teeth were never just part of your genetic blueprint, so you're missing these teeth. However, most of the time, the teeth are lost due to gum disease, deep cavity, a failed restoration, or a cracked root. The procedure to remove the offending tooth is more uncomfortable than actually placing the implant. The implant body itself is placed at 15 RPMs. It goes in so slowly that it doesn't really look like it's moving that much. In comparison, a dental handpiece that we use to do a filling works at almost 20,000 RPMs. Myth number 3. Everyone can get an implant. This isn't exactly true. You need a thorough dental and medical history to rule out certain conditions that may predispose you to a lower long-term successful outcome. Uncontrolled diabetes, previous history of osteoporosis, untreated hypertension may require physician's checkup and treatment before we place an implant. Other factors such as smoking, dental hygiene, and uncontrolled teeth grinding may make a patient an unfavorable candidate to get an implant. And finally, there's the quantity and quality of bone available to place the implant that may require that the patient get a bone augmentation prior to getting the implant. It's really best to consult with the dentist before assuming you can replace every missing tooth with an implant. These are the 3 most common questions I get when it comes to implants, and I hope this helped answer some of your questions as well. Thank you for listening. This is Dr. Vinh.